Dr. Perry Carpenter. I'd like to thank you for taking the time to join me on today's video. On today's video, we're in session 2 of our new program entitled Range of Motion Testing of the Spine. And in today's discussion, we're talking about how to obtain accurate measurements of the cervical spine. And I have a fascinating demonstration for you today. Today we're going to go over the proper use of dual digital inclinometers, and I have a colleague, Dr. Lee Kinney, here, who's here today to help me with this demonstration. Now, in a minute, we're going to be obtaining the actual measurements of cervical flexion extension, cervical left and right lateral flexion, and cervical left and right rotation. But before we get into the actual measurements, it's important to review a couple of basic principles about range of motion testing in general and use of digital inclinometers specifically. Now, the AMA guides require the use of inclinometers. These instruments that we have to demonstrate to you today are digital inclinometers, and these are dual digital inclinometers. We have 2 different brands here to demonstrate to you. And the beauty of using digital and dual inclinometers is that the dual inclinometer system eliminates the need to have to go through the math calculations that are required by the AMA guides, because the system actually produces the calculation, actually performs the calculation for you and gives you the final range of motion reading. So important principles regarding range of motion testing and the use of dual digital inclinometers include, number 1, that the examinee must be fully warmed up prior to obtaining the range of motion measurements. Now, the AMA guides tell us that the examinee has to be fully warmed up by repeating each range of motion 3 times. And my suggestion to you is that you fully warm up the examinee to include not only the warm-up ranges of motion, but also to perform the entirety of your examination prior to obtaining the range of motion measurements with your dual inclinometer system. So that means you would warm up the examinee with the ranges of motion. You would go through the entirety of your physical exam, including your radiculopathy assessment, your manual muscle testing assessment, your neurologic evaluation involving the motor testing of the upper extremities, and make sure that the examinee is fully warmed up to your full satisfaction, so that when you actually go to obtain the range of motion measurements, you're convinced that the examinee is providing you the full extent of their available range of voluntary motion. Okay? And then as far as actually using the dual inclinometers themselves, Dr. Kinney has a couple of suggestions for you as well.
Hello, I'm Dr. Kinney. I'm going to be going over the range of motion principles today. Again, this is the dual inclinometer we will be using. And let me show you here. This is the master, which has the readout, as you can see. Right here. This is the companion, right here. If I move this way, you can see how the readings change. If I move it this way, you can see how the readings change. Or if I move it this way, how it changes. Wherever we have those readings, then we can hit the number and record that finding. So in order to properly do this testing, what we need to do is the master will always go on the most fixed position. So for example, if we're doing a cervical range of motion, we will put the master on T1 or to the side of the shoulder, and we'll put the companion or the slave on the head, which is the most movable segment. Again, it's important to remember you want to grasp that firmly. Many times like this, so your thumb and little finger can extend out. So if you're doing forward flexion, you'll want to put it on the vertex, the back of the head, so you have better control. And then you ask the examinee to maximally flex at the end of range of motion so we can get the full range of motion. And we're going to come back up, record it, and repeat that 3 times. Again, make sure they're warmed up first. That's very important. And when we're doing extension, you'll want to put the companion unit, where you have the best control here, and as you're extending back with firm control, go back all the way, maximum range of motion, and record that, and then you come back forward. To neutral again, you're going to want to always zero that out and do 3 readings. So again, we want to always have the master at the most fixed area, the companion at the most mobile area, where you have better control with a firm grip, and you encourage full range of motion by verbally explaining that to the examinee that you're working on. Now what we're going to do is we're going to show how to do some of these range of motion techniques in the next segment here.
Okay, so now we're going to demonstrate how to obtain the flexion and extension range of motion measurements using the dual digital inclinometers. Okay, so as Dr. Kenny mentioned, we're going to want to take the master controller, the one with the display, is referred to in the literature as the master controller. So the master controller is going to go on the fixed segment, which in this case is the T1 region of the spine. So I'm placing this instrument in the sagittal plane with these 2 borders of the instrument centered over the T1 spinous process. And then this one is referred to as the slave. Dr. Kinney, I think, referred to it as the companion. So it's either the slave or the companion. And this is going to go on the mobile segment, which is here at the vertex of the head. Now, in order to maximize control of the examinee, you can tinker or experiment with the positioning of the slave or the, what did you call it?
Companion.
The companion. You can tinker with the position of the slave or the companion to where you feel like you have maximum control. So when you're testing cervical flexion, the most ideal position for the companion is posterior on the examinee's head. Now it doesn't matter where you position it on the examinee's head, because you're going to zero out the instrument irrespective of the positioning. The instrument zeroes itself irrespective of the positioning. So once you get your positioning, tinker with the position of the companion to where you feel like you have the most control, which for flexion is slightly posteriorly. Okay? So once your instruments are fixed, go ahead and zero the display and ask the examinee to bring their chin to their chest and to go through maximum range of motion, all the while encouraging them to maximize their range of motion. Go ahead, as far as you can. Go as far as you can. Is that it?
Mm-hmm.
Okay, good. Come back to neutral. Zero the instrument and repeat 3 times using the maximum range of motion measurement as your range of motion value. Okay? And then for extension, same principle. The master controller goes over the T1 spinous process. The slave or companion is going to go slightly anteriorly, where you'll be able to maximize your control of the examinee's head. Zero your instrument, and then ask the examinee to go through extension to full range of motion. And provide them some encouragement, both in the form of verbal encouragement. Go ahead. Go ahead. Come on. Is that it?
Mm-hmm.
Okay. And then come forward. Zero your instrument. Repeat 3 times. And to encourage the examinee to go through the extreme of the range of motion, provide a little slight overpressure at the end of range of motion, along with your verbal encouragements. And in this way, you can be certain that you're obtaining maximum ranges of motion. Okay? So now let's have Dr. Kinney demonstrate to us how to obtain bilateral lateral flexion range of motion measurements.
Well, this is Dr. Kinney showing you how to do a lateral range of motion on the dual inclinometer again. That the master unit will be put at T1 and companion unit will be placed in the most comfortable area, the most comfortable position where you have good control of the head on lateral flexion. So this is going to be a left lateral flexion, and we're going to position it this area. If you need to, you can go right laterally here, away from T1 also, position that area and stabilize if you feel like you need to. Okay, so what we're going to do, so we're going to hit 0 this out. You can see if I move this here, move this here, I've got good stability in my small finger and thumb, and we're going to do, so 0 it out, we're going to do a lateral flexion to the side. Okay, let's go. Let's do maximum, extend the best effort you can. Good, good, good. Okay, right there. Okay, let's have you come back. We're going to neutralize that out. Okay, let's go laterally again. That's right, let's try maximum effort yourself. Now, all these three readings should be within 10%. Okay, good. There, now let's maximize it again. Okay, and you can come back. Good. Okay, and the readings were 47, 46, 47. Now let's go, we're going to do the opposite reading now, opposite side. So what we'll do, we still get the master unit and have it in the most fixed position. And what we can do is just position this however it's comfortable for you. You can put your fingers in between this way or this way, whatever's the most comfortable, where you can get the best leverage on the head. And what we'll do here, we'll want to 0 this out. 0 the unit out. Okay, now let's move laterally to the right. Firm grasp on both areas. And verbally explain, let's do maximum effort. Does it feel like it's at the end?
Yep.
Okay, okay. Let's come back up now. Record that. Okay, 0 it out. Now let's go back again. Firm grip. Keeping it very stable. Ask them to do maximum effort. So feel like it's...
Yep.
Record that. Come back up. 0 it out. And one more time. Okay. Let's do the maximum effort you can. But it's always gentle and you aren't forcing it. It's just you meet a little more resistance at first at maximum range of motion. You feel like you're at the max there?
Yep.
Okay, record that and come back up. Okay, so our readings are 49, 50, and 50. Okay, so we're doing, according to the AMA guidelines, 5th edition, the cervical range of motion should be done in a supine position with the shoulders firmly on the surface. Okay, I've got, now this is the single. I've unattached the dual. This is a single master. I put it on the forehead. I'm putting my hand, I'm sitting on the opposite side where I'm going to do the range of motion. We're going to do a left range of motion, so I'm sitting on the opposite side. I've got my thumb and index finger under the occiput and the thumb right around where the jaw is. So I have a good, firm, stable grip. I turn it on, 0 the unit out, and have the examinee maximally rotate to the head to the left with still a firm grip on the occiput, and I'm firmly holding the inclinometers right position. Are you at maximum range of motion?
Yes.
Okay, and I record that. So we bring it back to neutral, 0 it out, and now we have rotate to the left again, maximally. You there?
Yep.
Okay, again. Okay. Now, 0 it out, and one more time. With a firm grip on both areas, rotate. Again, it should all be within 10%. Feel like you're maxed out?
Yep.
And record it. Okay, we have 70, 71, 71. Good normal range of motion. Now, typically I'd be in a stool that had a roller on it. So I'm just going to bring it over here, and we're going to be doing the same Same maneuver. Only thing I'm going to do is switch hands this time. Turn it off, turn it on. Position my hand again, thumb and index finger. Zero it out. Okay. Okay, zero it out. Okay. Rotate maximally. Feel like you're at the end?
Yep.
And record it. Okay, good, good, good. Okay, back to neutral. Zero it out. Okay, let's go back. Maximum rotation to the right. And you can feel when it gets you. Have the examinee do maximum effort. And you can feel when the tension's there. Does it feel like it's maxed to you?
Yep.
Does it feel tight? Good. Okay. Okay, back to neutral. If this happens to move or slip, it doesn't matter because you're zeroing it out. Okay, we're going to go one more time, third time. Okay, feel like you're there?
Yep.
Good. Okay. Okay, back to normal. Okay, so we have the ranges of motion. We're at 71, 69, and 70.